Joining us is Dr. Shawn Iaddonato. He's co-founder and executive vice president and chief scientific officer of Kineta. Is that it?
That's it.
And we're going to talk to you. There's some great breakthrough research going on in MS. And welcome.
Thank you very much.
Thanks for coming in.
Thanks for the invitation.
Thanks.
Well, I'm just, if you don't mind, I'm just going to call you Dr. Shawn.
Oh, perfect. Yeah. Not
Shawn.
even my mother calls me doctor. So.
Okay. Hey, let's talk about MS. For those listeners out there, what is MS?
Well, MS is basically a disease of inflammation. It's the way I describe it to a lot of people is it's just like the inflammation that you get in a joint if you go out running and you twist your ankle. So a lot of that redness and heat and firmness that you get in your ankle, it's the same thing that is going on in your brain. It's when your immune system gets out of whack and it starts to destroy healthy tissue in the brain. That's basically what MS is. So
it's essentially one of those diseases that we hear of, those autoimmune diseases where the body essentially is attacking itself.
That's right.
And in MS, if I've read right, it attacks the myelin sheath. And describe how that myelin sheath is important in the nerves and what's going on there.
Sure. So all of our nerves are basically like a piece of Romax that we would put in our house, or wire that we would put in our house. You have the conductive wire in the center, and then you have some insulation on the outside. And the myelin is essentially like that insulation that you would have on the outside of that wire. And the immune system starts to attack that, and over time you lose that insulator coating, and then those nerves are exposed and they start to get destroyed.
And what are the typical symptoms that someone might experience?
So I think, typically in the beginning with multiple sclerosis, you see a lot of people have visual problems, they have difficulty with their hearing, or they have sensory problems, some miscoordination, things like that early on in the disease. And then what happens is, in the brain, you have these bouts of inflammation, like I was talking about twisting your ankle. So if you go out every Friday for a year and you keep twisting the same ankle, you have inflammation. Typically, every time you twist it, the ankle gets better. But over time, all that inflammation starts to destroy the joint. And that's what happens in the brain. So then you start to get things like paralysis, difficulty walking, neuropathic pain, which is, unexplained pain, things like that.
Who gets MS? I mean, is it more men or women? Is there an age, that it hits, or just random?
Well, it can start very young, but it typically starts in people who are between 30 and 50, 25 and 50, and it's about 2 times more likely in women than in men. And one of the things that's the most interesting for us here is that it's very common in the Northwest.
Yeah.
I've heard that before.
And why is that?
Well, it seems like, we don't know. It seems in general, the further you get from the equator, the more multiple sclerosis you get. And why that is exactly, whether it's a lack of sunshine or whether it has to do with something related to infectious disease that they have at the equator that we don't have here, we don't know.
Is it both directions, both north and south? So in the southern hemisphere, do they have the same incident of MS?
Yes, that's right. Yeah, it seems as if the further from the equator that you go, the more MS you get. If you take people who are born in England and they move to one of those traditional English colonies like South Africa, they will have less MS depending upon how early in their life they move to a place like South Africa.
But if somebody in England has MS, the beginning stages, and moves to the equator, does it stop the progression?
It doesn't appear to. There's not a lot that's been written on that. I know in the 60s and 70s, I think physicians used to recommend that their patients move to warmer climates if they had MS, but I don't think there's really anything good to suggest that helps once the disease has begun.
Well, I've often heard that heat actually exacerbates or increases the symptoms of MS.
That's right, and many patients report that even after a hot shower, they can feel more fatigue or more of their MS symptoms.
And so what's going on today in the world to treat this? I mean, I know there's a lot of research, and your company's got some interesting and innovative research going on. Let's talk about what you're doing.
Well, our company is really focused on a new therapy to treat MS. One of the big things with a lot of the MS therapies that are on the market today is they're pretty old drugs. One of the drugs that's very commonly used is a drug called interferon that was discovered in 1955. So that gives you a sense of how old those drugs are. And a lot of those drugs have two basic problems. They either suppress the whole immune system, which leaves people sensitive to infection, or they just have a lot of side effects. You see that with interferon, where people have a lot of fever and flu-like symptoms and things like that. So what we're trying to do at Kineta is really develop drugs that are more specialized, more specific, just more modern, and so they don't have so much toxicity.
And so do you have anything you're working on right now? I understand you have something SHK-186 potassium channel blocker. That sounds pretty scientific, pretty technical.
Well, yeah, but it's an interesting product. I mean, the product was developed by a guy named George Chandy at the University of California at Irvine. And, it was really based on some unusual discoveries that were really written up as anecdotes in medical journals and things like that, where you would have somebody with MS who was hiking in Arizona, who got stung by a scorpion and would have a resolution of his symptoms for weeks. We know of a physician who we've been corresponding with in the UK who was swimming in Barbados, got stung by a fire coral, and his symptoms went away for a period of time. And that got this fellow who invented the drug thinking about what it was in these venom that was causing these observations. And so this thing here that we're developing as this drug is really a component of a venom from a sea sponge, a sea anemone, a sun anemone, wow, which we can manufacture in the laboratory. And that is.
So your company is extracting or looking at this protein and then synthetically making it in a laboratory, and the results are slowing the progression of MS? Because MS, let's remember, it's a progressive disease.
That's right.
I mean, it gets worse over time, and people have these relapses, and each relapse they have a little more symptomology, and they lose a little bit of more function. So this is exciting stuff, because this is big in the Northwest. I mean, I know there's a lot of MS around, and tell us what this drug is doing, or potentially
and who are you
could
testing
do.
this on? Yeah, well, so far just laboratory animals, but we are hoping to bring the drug into clinical trials later this year, and the drug. I've forgotten your question, but the drug basically.
Wait, does it stop the disease? Does it reverse it? What have you seen in laboratory animals?
So what we basically see is that it's doing a really good job of controlling the inflammatory reaction in the brain. So I think in the condition where you had a lot of loss of the nerves already, we wouldn't look for this drug to do much in that case. But what we're looking for the drug to do is to control the inflammatory process so that you don't have new damage occurring in the brain. And I think the thing that we've observed with the drug so far, which is pretty encouraging for us, is that it seems to leave most of the immune system intact. So the animals, at least, that are on the drug, they're able to fight infection normally as far as we can determine. So, the next thing for us is to really move the drug into the clinic and start to evaluate it in people.
So in the laboratory results that you're seeing are if an animal has paralysis or weakness and they take the drug, is some of that paralysis diminishing? Is the weakness, or is there more strength returning? Have you seen those results?
You do, and a lot of the paralysis that you see in animals, and a lot of the paralysis that you see in humans too, are just the deficits that you see occur during flare or during relapse.
Okay.
And we think a lot of that is related to inflammation. Just like if you twisted your ankle, you would have a hard time walking on it, but over time you would have a normal restoration of function in that ankle. We think that is happening during a lot of relapse. Over time, though, after you have bout after bout of inflammation, then you get more permanent damage, we think, in the brain, and this drug is really not to address that.
So any other diseases, autoimmune diseases that you're looking at besides MS with this drug? Because it sounds pretty promising.
Yeah. Well, so, all of these autoimmune diseases are very similar. So type 1 diabetes, which is an inflammation of the insulin-producing cell, rheumatoid arthritis, which is an inflammation of the lining of the joint. Those are all very common in terms of, they're very similar to MS in terms of how they operate. We just received actually an investment from the Iacocca Foundation, Lee Iacocca's family foundation, last week to focus this drug on type 1 diabetes. So we've initiated a type 1 diabetes program, and we're evaluating the drug for that application.
And Kineta is your company. How old is Kineta?
Well, Connect is only 2 years old, but our whole team has been working in biotech here in Seattle for about 10 years. So we had a previous company that was focused on primarily antiviral research, which we sold a couple of years ago, and we kept our team of scientists together to start Connect.
And you had a kind of an interesting job prior. You were with the University of Washington in human genome studies, so you've got a lot of background in this kind of stuff, huh?
Yeah. Well, I started out, at the university as a scientist there, working on the Human Genome Project, and basically looking for business opportunities related to some of the research that we were doing.
So do you see, with your experience and what you've seen over the last several years, because there seems this genetic or bioengineering that's going on in the world today, and Seattle seems to have a lot of these companies out there.
Is this a big place for that kind of...
Or is it just popular all over?
Yeah.
Oh, yeah. No, Seattle's a big place for biotech. I think that we have created a lot of small companies here doing a lot of really interesting things and just a lot of neat things that are going on. And a lot of the innovation that's going on is going on in these little companies. It's not going on in kind of those big institutional pharmaceutical companies anymore.
It sounds like a lot of upside. But you mentioned clinical trials, and all I've heard about trying to get these drugs to market, just how difficult and time-consuming and also very expensive. Tell us a little about the clinical trial that you're in.
Yeah.
And what levels there are to these trials.
So typically, we haven't started the first clinical trial for our multiple sclerosis drug, but typically you go through 3 phases of clinical trials. So the first phase is where you really are only evaluating the safety of the drug, and you have to show to the FDA that you've developed the drug and manufactured it in such a way that it's safe. And so you start at a really low dose, and often you do those trials in healthy volunteers. So there happen to be...
You want to sign up?
Healthy volunteers.
Yeah. So lots of college students, actually, they can participate in one clinical trial.
That's how you buy your book.
You get paid for it.
Right, that's right. So you see a lot of these so-called phase 1 sites, they're right next to a university somewhere. And then as you get into phase 2, then you're evaluating the safety of the drug, as well as you start to look at, is it going to work? Is it going to treat multiple sclerosis or type 1 diabetes or whatever the application is? And then the third phase, you have these much larger trials where you're really trying to convince the FDA that they should let you market the drug so that it's safe and effective, and really the cost goes up the further along you get.
What is the typical time frame from that clinical first phase to where that drug's approved? Mm-hmm. And secondly, what is the expense? I mean, I've heard it's just millions and millions of dollars to get through that process.
So you typically, the clinical stage, it's about 5 years.
Mm-hmm.
And it depends a lot on the disease. So if you have a really, acute disease like a bacterial infection, your patients are in the hospital and you can clear it up in 14 days, then your trials will run faster, assuming that you can recruit the patients. In MS, where patients are typically followed for 2 years and you do a lot of brain scanning, it can take longer to run a trial. And, in terms of cost, the pharmaceutical industry typically spends a lot, but when they tell you how much they cost, they factor in a lot of the failure of their drugs. So the costs that they are quoting are pretty high, but it can run into $200 or $300 million in real costs to develop a drug.
Wow.
Well, this is great stuff. Thank you so much, Doc. I'm gonna try the name again, Dr. Shawn Donato.
Okay, exactly.